I think there was also just a lot of, a lot of anxiety about what could go wrong, and just feeling, not ready, like just not ready for that change in my life, because it is quite a drastic change. I'm not going to lie.
My nephrologist strongly suggested that I choose peritoneal dialysis as my modality, which, suited my lifestyle. I was very active, liked to travel, and it worked actually very well for me. I continue to work full time. The cycler machine was very easy to learn.
So it is something that you have to both be physically ready for it, and you also have to be mentally ready for it as well. And I went to a number of the training programs that were offered at the hospital and the clinic here, and I read a lot of the materials. I even talked to other patients who had recently, done the transition and gone on to dialysis treatment for their kidney disease.
It gave me such a feeling of autonomy to not be on a schedule where I had to turn up at an in-center place. So that versatility was important. We've talked about travel with dialysis and how that on peritoneal it works, but it maybe doesn't work so well with hemodialysis. I was able to travel with this little machine.
And as a caregiver, it's 100% important that we know how to care for them. I knew how to put them on the machine. I knew how to take them off the machine. It was as regular as making supper every day.
I think the big thing about home dialysis for home hemo was the daily rituals, which were very, very time consuming, I found. It was almost like a full-time job. The machines require daily disinfecting. You have to set up your supplies, put yourself on, doing your own blood work, taking supplies and taking samples to a lab. The water purification machine required checking of chlorine levels, disinfecting. The cost of electricity and water increased quite a bit for a home. And I think there was anxiety on dialysis. Will something go wrong?
It's such a big step, and it's so very different from doing it in the training situation. We've all talked about this, there is anxiety. There is the scary feeling of that suddenly you are administrating something that's pretty complicated.
I just would suggest that practitioners just really, really be patient. Just really, realize how overwhelming it is, and realize how much a person is trying to manage and juggle and figure out all at once.
Through all the modalities that Glenn did of dialysis, other than the in-center, I took all the training that he did. So what he went through, I went through to learn how to hook him up, unhook him. He ended up in the hospital, in the emergency room, and the emergency room staff didn't know how to hook up a PD patient to dialysis. It was actually kind of shocking. He needed to do what they call an exchange. And I said, okay, well, just take me to the room, let you have all the supplies, I'll get everything that I need, and I'll do it. And I did. And they would say like, well, we didn't know how to do this. It was, thank goodness you're here kind of thing.
And I think the health, energy, and easy diet benefits for this modality are excellent. I think, however, in order to master all aspects, it does take a great deal of time, knowledge, and discipline.
Since I think about home hemodialysis as being very challenging, to be honest, in many ways, it is easier to do in-center dialysis because the experts are doing all the work. But in home hemodialysis, you are becoming your own caregiver, which is a very scary thing.
You have to be your own advocate, and you have to voice your concerns. You have to share how you feel, and that is how you're going to be able to optimize the treatment that you're getting.
Having kidney disease throws you for such a loop, and you feel disempowered all of a sudden, because you know your life is going to change, your future changes. But if you can take it on and kind of push it away a bit and say, I'm in control, then that empowers you and it gives you a sense of pride and control.